I'm here to give you a historical perspective, and I've reached the age where I feel very qualified to talk about history at this point. So let's just get started a little. Let's talk about the problem first of all. The basic problem is that about 1 in 100 people have epilepsy, and that we get 2/3 of those people under control with the anti-epileptic medications. But that means about 1 in 300 people are living with uncontrolled epilepsy at this point. Now, I'm a co-director of EpLink. That is the epilepsy research program of the Ontario Brain Institute. And our program is centered around therapies. We're not basic science so much as we are applied science. We're trying to find new ways to stop seizures and help people to live with seizures. We've looked at a number of new drugs, but the one that we're most interested in now is cannabidiol. Cannabidiol, or CBD, may be an important new therapy for epilepsy. Okay, cannabidiol is an extract from the cannabis plant that's often referred to as marijuana, and it's been used in medicine since ancient times. They think that it probably originally grew in either South Asia or China, gradually spread all around the world, has been used in the production of rope, in other words, as hemp and fiber, and has also been used in medicine for thousands of years. Specifically, it's been used to stop seizures. So they've really known for thousands of years that the cannabis plant could stop seizures. The problem is that cannabis itself makes you high. In other words, that's the street use of marijuana, is to get high. And of course, that is a drawback in a drug that we want to use to control seizures. So the big drawback with cannabis or marijuana itself is its psychotoxic properties. Now, in the middle of the 20th century, they began to extract the pure extracts from the cannabis plant. There have been many, many different extracts. They say there's more than 85 different compounds you can get out of marijuana. But the two major ones are THC, which stops seizures but makes you high, and CBD, cannabidiol, which stops seizures and doesn't make you high. So cannabidiol, of course, is what we're interested in. We feel that it has the potential to be developed into an important new therapy for epilepsy. Now, with epilepsy therapies, and that's what my lab does a lot, with epilepsy therapies, the first thing you do is test them in animals before you look at testing them in people. Cannabidiol has been tested in animals, and it clearly works. With my postdoctoral fellow, Miles Thompson, Dr. Miles Thompson, there he is. Miles and I have been reviewing the animal literature on cannabidiol, and it clearly stops seizures in animals. So that's the first thing to say. It also seems to stop seizures without causing too many side effects that we can tell, although of course you can't really tell how well an animal is functioning intellectually, but certainly we don't see obvious side effects. So it does work in animals, and it does work to stop seizures. Now, the next thing you do when you're developing a new therapy is to follow your animal trials with trials in humans. And that's where we really are at this point. There have been very few trials in humans. That's because marijuana itself is considered a street drug and an addicting drug, and therefore it's been very hard to work with. So simply saying, human studies are needed to show that the therapy works in people. We have to make sure that the animal data are accurate in predicting that it'll stop seizures in people. We need to figure out exactly what dose is needed and whether there are side effects we don't to suspect at this point. Medical doctors could let their patients have marijuana or a marijuana extract, but they're very uncomfortable with that so far because we don't really know the proper dose in humans. We don't know the possible side effects in humans. So we do need clinical trials of cannabidiol, but due to all the regulations related to marijuana, there have been very, very few clinical trials so far. We're currently at EpLink organizing a clinical trial of cannabidiol. It's going to be a placebo-controlled double-blind trial in adults with uncontrolled seizures, okay? Basically, placebo-controlled means that half of the patients are going to get cannabidiol, the other half are going to get an inert substance that looks just the same. So half of them get the drug, half of them get a placebo. The second thing is that it's double-blind. The patient doesn't know whether he's getting drug or placebo, and the doctor doesn't know either. Only I will know at this point, and I won't be telling. And you have to do it this way so that patient expectations don't give you false positives, or the doctor's hopes of improvement don't give you false positives. Okay, so it'll be double-blind and placebo-controlled. We're working through the paperwork, and I'll tell you, it's fierce, but with luck, we might be able to start enrolling people next summer. Just to say, our goal is to determine whether cannabidiol works and it's safe in people with seizures. And our hope is that if the trial is successful, then doctors will begin to use cannabidiol as a compound for seizure control. They could do it now, but they're not comfortable yet. We're hoping that if our study is positive, it's going to make doctors more comfortable with using it.